Well, look what this is going through here, guys. That's right. Naya and Mary, this part of the bone, we're going to come here. 4 fingers in this hole. We keep pushing. We're going to push it completely, okay? The vein is full of veins. Combing means the vein is completely blocked. It's a bubble of alcohol. Well, and the direction is like this, not upwards. So I could do it like this. No problem. But the best thing I can do right now is here. And the needle stick up. We can go down here. Don't try to do it first. Leave it to the end. You can't really do the injections anymore. The vein is broken. We usually do it there. So this vein is completely bombed. It's got to be under the skin. He said 45 degrees. I was completely injected. Now I finished my injection. I finished my injection. That was the conversation we had that pressed it. Absolutely a minute or two. Keep the place of the ornament, whether in the dairy cow or the goose injection site. Hold on to alcohol for a minute or two. Because if the vein penetrates and this needle is leaking out of the blood and it's your phlebitage, or our severe vein inflammation causes very severe pain. Cystic and spinal cord are usually affected by this type of nerve. This is how it comes in here on the femur and the bone part of the hip. So look at this. Come here and see the injections you see here, the muscles that are here. It's very weak, but you see the muscle here, the whole, and the whole body is here. The best place to inject is for those over 4 or 5 months of age, when another muscle is formed. It's the best muscle injection. Look, this is a piece of bone. We call it a pelvic bone, so this is the bone at the head of the bone over here. We'll come here with an injection into the old calves. Cows are the best place to inject in here, not here, not here. We don't hit here. Wherever you hit, it hits nerves and paralysis, but here. My best condition is for old age, but for this age, the best time is this part. You're a complete alcoholic. Gabe and Kef don't eat. We'll do full disinfection. I'm not going out after the injections because you're doing the injection. Then try to get all your injections. If your injection volume is high, you can still beat a muscle. You can choose a neck muscle. It's one of the healthiest and healthiest ones. And the best place to get the injections is the neck muscle. And here's the bone, and here we have no killing muscle. And here we do the injections, the further back the diameter of the muscle. There's more. Give me another cotton of alcohol. So, I'm showing this for a subcutaneous injection. This is the location where the coat and the neck connect. You see, here we pull up the skin and perform the injection. Absolutely, absolutely do not repeat this. Sure, it may be a bit hasty, but I'm actually referring to these concoctions that come about due to when our injection is contaminated or we have used a needle once. One of the things that's very important, and you should consume a whole year of your injection, may actually cost $1 million. Its cost may be much, but if one calf or one beef catches leukemia, a blood cancer, it's enough to infect a whole cycle. The whole cow and beef surface also gets infected. Why, if your injection is contaminated, do conduct a once-used injection for each case. This is very easy. You put a bowl of alcohol, pull the skin up and inject. You can see now the needle is completely under the skin. Neither has it gone into the skin nor in the muscle. It's completely under the skin. This is another place to inject. You can feel it on the scapula here. Here we call it scapula, that is shoulder bone. You see here, if you touch, it's completely loose. It's shoulder bone. We don't inject here. We inject in this part behind here. We inject behind this shoulder bone. We would prefer to inject here because there is more muscle. Absorption is easier. There is still a bone here, so absorption is lower, which is why we inject it very easily under the skin of the neck.